Not a non-alcoholic fatty liver and fibrosis. Definition. Non-alcoholic fatty liver disease is a complex condition involving the progression from simple stages to inflammation, and to severe fibrosis and hepatocellular carcinoma, which are the major predictors of death in patients with this disease.
The liver carries out many vital functions, including nutrient metabolism carried out by specialized cells called hepatocytes. For example, when excess glucose is present within the hepatocyte, it can be transformed into fatty acids, known as de novo synthesis. Hepatocytes are also key regulators of lipid metabolism. They take up fatty acids from blood and assemble them with glycerol to produce triglycerides. Lifestyle habits, such as a chronically unhealthy diet and a lack of physical activity, can lead to non-alcoholic fatty liver, or NAFL with isolated steatosis, defined as an abnormal accumulation of fat in the hepatocytes. Individuals with associated metabolic disorders, such as insulin resistance, type 2 diabetes, and obesity, are particularly at high risk to progress to a pathological state called non-alcoholic steatohepatitis, or NASH. In people
Application in nursing. A study recently reported by Sutherland investigated the inhibition of notch signaling as a therapeutic strategy against fibrosis caused by non-alcoholic fatty liver disease. Although under normal circumstances, notch signaling is abolished and hepatocytes after differentiation. The authors found an upregulation of this signaling in the livers of persons with non-alcoholic fatty liver disease and in mice fed a NASH diet.
Non-alcoholic fatty liver disease is a condition in which there is accumulation of excess fat in the liver, not due to excessive alcohol consumption. It's a very common condition in clinical practice. It affects about 20% of the world population. We care about fatty liver disease because it is one of the problems which can cause liver failure, liver cancer, and the need for liver transplantation. The presence of extra fat in the liver can cause chronic irritation of the liver cells and subsequently can cause further liver damage.
Pros and cons. Pros. Importantly, downregulation and ablation of notch signal in these mice results in a melioration of liver fibrosis. Cons. A mainly randomized study with the use of human sequence variation that have been associated with increased lipid fat showed that hepatic steatosis has a causal role in liver fibrosis.
We didn't want to discuss the main cause of non-alcoholic fatty liver disease, as well as simple and proven solutions, and a couple of them that you can implement right away. Now, today, to talk about non-alcoholic fatty liver disease is because I've noticed that this is turning into a big problem. So much so that it's estimated that it affects 25% of the population. There's also alcoholic liver disease, which is caused by consuming too much alcohol. But people with non-alcoholic fatty liver disease do not consume any or just very little alcohol, but they do consume a large amount of other types of foods, and I'll tell you about that in a minute. Now, both the non-alcoholic fatty liver disease and the alcoholic liver disease will cause scarring of your liver, which can lead to cirrhosis, which can lead to liver cancer or failure.
Issue applied in Ecuador. This data support observation that excess liver fat is deleterious to the liver, that sustained notch signaling induces liver fibrosis in the presence of lipid accumulation, and that the suppression of notch signaling or liver fat content may ameliorate liver fibrosis.
with alcohol can still develop liver problems, serious ones. Non-alcoholic fatty liver disease affects some 80 million people in the United States. That's a big number. Here to tell us about it, Dr. Robert Brown, Medical Director of the Transplantation Initiative at Columbia University College of Physicians and Surgeons. It's a long title of a school. Dr. Brown, thanks for coming in. First of all, for people out here who haven't heard much about it, what is fatty liver disease?
Most people think of liver disease as a problem just in people who drink alcohol or do other bad things to themselves. But non-alcoholic fatty liver disease is a condition where fat accumulates in the liver, and then the liver becomes inflamed and even scarred all the way to cirrhosis without alcohol or any of those other known
So no alcohol, but are there behavioral elements that contribute to it?
Yes. It's most common in patients who are either obese or diabetic, but we have a proportion of patients who are not overweight who still seem to have this, and there are probably genetic factors as well. We see it in higher rates, for example, in the Hispanic community.
In terms of, and I read that upward of 70% of people who have type 2 diabetes can develop this, is that right?
Yeah, almost everyone who is diabetic will have some degree of fat in their liver, and a good proportion can go on to develop this NASH, this more serious form that can go on to develop advanced liver problems.
Okay, so what are some of the symptoms?
Conclusion. In conclusion, the regulation of node signaling represents a candidate therapeutic target against fibrosis in patients with non-alcoholic fatty liver disease.
Linder is here now talking about the Emerging Trends Symposium. And can you give us an overview?
Sure. This will be a day and a half of really all the major topics in non-alcoholic fatty liver disease. We want to give people an understanding of where the field currently is and where we think it's going to be moving. It's an exciting time. There's lots of new thoughts about what kinds of endpoints we might use to design clinical trials. And fortunately, many companies have developed an interest in new products that could be tested in this condition. So very timely to have this conference.
There has been study and discussion on non-alcoholic fatty liver disease for many, many years.
Yeah.
So why is this included in an Emerging Trends Symposium?
Well, I think one skeptical view would be that hepatitis C has moved along so far that now people are interested in non-alcoholic fatty liver disease. But I think really what we have seen in the 35 years or so in which it's been described